Thank you. Kind of.
Good afternoon, everyone. We're going to get started. This is the Education Subcommittee of the House Ways and Means Committee. All of our advocates are entering the room now. I'm going to ask all of our advocates to make sure their screens are off. We're going to go through four. We have 4 bills on our agenda today. 2 we will discuss, and 2 we will potentially move today. I do want to have a real lengthy discussion on some of these bills because I think they're really important and potentially they could be moved at some point, but today just is not, I don't think they're ready for us to move just yet. So with that said, let's start with HB 370, Delegate Kerr's bill. Alistair, can you give us a snapshot of what this bill does?
Yes, absolutely. So this bill is primarily designed to make sure that schools are prepared with seizure action plans to treat students diagnosed with seizure disorder. Beginning 2 school years from now, in the 2022-2023 school year, this bill would require that at least 2 school employees be trained in recognizing the signs and symptoms of a seizure and appropriate steps for administering first aid. One of those people could be a school nurse, and that training could contribute to any professional certificates. Additionally, everyone who has any contact with a student, including bus drivers, contracted employees, guidance counselors, classroom aides, therapists, and administrators, would be required to recognize the signs and symptoms of a seizure, to be trained in recognizing the signs and symptoms of a seizure, and taking appropriate steps for administering the seizure, first aid for seizure. Additionally, there's some language making sure that parents or guardians of children who have been diagnosed with seizure disorder collaborate on the seizure action plan that is developed. The state board is required to adopt regulations, and additionally, people administering first aid, unless they willfully or grossly commit a negligent act, are free from any civil litigation arising out of that. And additionally, there's some authorizing language in here for non-public schools, but it would be mandatory for public schools and authorizing for non-public schools. So this is similar to, we currently have on the books similar law about the administration of epinephrine, and this would do the similar things for seizures. Does that answer all questions? Is that a good enough summary, Mr. Chair?
Well, that answers the summary question, sure.
Thank you, sir.
Any questions on this bill, any discussion on this bill? I think there's, it mandates a lot of training for everyone, particularly in the school system, which could be over, that's a lot of training for everyone. That's drawn some concerns from our school systems and other folks too. But I do want to discuss, what other concerns you may have with the bill that advocates or other folks might have brought up, but also what any ideas on which we can get something like this done. I rewatched the hearing for this bill, and we know that this is an important issue to many families that suffer from seizures, students that suffer from seizures in our schools. So I didn't want to bring it up for discussion at least and see if anyone has any ideas. Delegate Rose.
Thank you, Mr. Chair. And I think that the intent for this bill is very good. And is there a way, and has anyone proposed any amendments where we can, get what we're looking for, but not make it maybe quite as onerous? I don't really have a magic answer. I'm just throwing that out there for discussion because I do think it's important.
Yeah, me too. There were some amendments that I know the Senate is considering, those don't speak to that issue exactly.
Okay.
There are some, ways to that we've been thinking about, which could be us discussing, maybe a focused strategy on training. That could be something that we can possibly consider. and who that training would be for. We need to decide on where we want that to be. So that's something that we can consider. Delegate Rose, follow up.
Just to follow up, could we, I think you said the bill said, or Alistair said, so it's 2 people per school. Could we reduce it to, the school nurse? The school nurse is versed in this. Is that good enough? Would that help? I mean, does that make it a little bit less? It makes sense to me. I'll throw that out there as an idea.
Yeah, that's something to consider. Definitely, we can put that on here, something to consider, but they are asking for other training to happen for bus drivers and anyone the student comes in contact with. So it's just not at the school, right?
Right.
So we just have to figure out who is the best trained and who could train a trainer. The trainer could train other folks, right?
Right.
So let's go to Delegate Hornberger.
Thank you, Mr. Speaker. Do we have any idea of the magnitude of seizures in schools? Is something that's tracked? Is it 1 per school, or are there schools that this isn't an issue?
It's a great question. Does any advocates have any? You can raise your hand and let us know if you know the answer to that at all. I'm seeing no raised hands, so I'm gonna take that as no one knows the answer to that. But maybe someone can get that answer to us at some point.
Yeah. The follow up is that I would think that generally, if a student was having this issue, that the parents would sort of notify the school, so we would kind of know where this is necessary. But if there's a school that doesn't have any students of this population, it seems a little onerous to mandate the training if they not going to use it.
Yeah, Delegate Guyton, you wanted to follow up with that?
Yeah, thank you so much. Thank you, Mr. Chair. And I appreciate that other people see the importance of this bill. I do as well. I think it's really important. And I think that I can't answer the specific numbers for Delegate Hornberger's question, but I do know that the main concern and the reason this bill was brought forward, in my understanding, is that most of the seizures occur for the first time at school. And so it's not something that parents will necessarily know about. It will just all of a sudden occur and nobody knows how to respond. And it can be life-threatening. So I agree that some of the training might be onerous, and I would love to see us hone that down in a way that's palatable to more people to be able to pass something on this bill, because I do think it's important.
Yeah, great. Delegate Hornberger, anything to that?
No, I just trying to get a scale of magnitude here.
Got it.
Thanks.
Okay, point taken. Thanks. Delegate Ebersol.
Yeah, and thanks, and Delegate Rose in particular for noting the size of the training. So yeah, annual training, I'm going to give you a perspective on what that's like, because there are about a dozen of them or so that teachers do. They're usually PowerPoints. There's no indication of who's providing the training here or how they're drumming it up or how long it's going to be. But they're rather routine at the beginning of the year. So as important an issue as this is, I think to prescribe another annual PowerPoint that teachers watch is not only going to take up time, which we've indicated, but it's also not going to be that effective. I went through them, and after a while, they become there's bloodborne pathogen one that you have to watch, and there's one on suicide prevention. And one year, I think in education sub, I got a list because we were doing this. And so I concern myself that we have a lot of very important things that teachers need to know about students, and there are ways of getting them to know it. But requiring a training at the beginning of the year is probably not going to be that effective. And if you do it every year, it will become something that is just sort of something to plow through. I wouldn't like to say it was me, but I had colleagues who figured out how long you had to stay on each slide so that it would count that you'd watched it, okay? The amount of time. If you went through too quickly, you didn't get credit for having watched it. But if you went through at the right pace, the questions were easy at the end. So I like that we're trying to get teachers aware. I'd like to suggest in general an alternative. We're going to have at least one and maybe two employees in the building. I am bothered it says they shall require somebody, because that would enable an administrator to go to me as a teacher and say, you're the guy, you have to do this. I don't think that's going to get a very good result. And I also noticed that we didn't require the non-publics. They may require, they didn't have to. I don't understand why non-publics have students with seizures who are less needy of understanding than they are in public schools. But I think if you're going to find people, and the epinephrine is an excellent example there, Analyst Johnston, because that's something where it was voluntary and the people who knew about it could explain it to others of us. Now, in that case, you had to be qualified to do it. But to have an expert in the building and to put in something that it'd be a faculty meeting at the beginning of the year, something like that, where one of my colleagues stands up and says, hey, I'm trained in this and I want to give you a 10-minute run through what you do. That's what hits home. That's what teachers remember. A video or a PowerPoint doesn't tend to work as well. So I'm interested in general in pulling back a little bit on what we require, but also perhaps using a slightly different method of delivery and just saying we're going to do an annual training where we're just reminded, because that's, we do it with suicide. They tell us things to look for, and then they're in my head for the year, stuff that is particular to that. The last comment I'll make is that Section H at the end is making a curricular requirement. That's something we rarely do for students, and so I was a little concerned about that one.
Yeah, thanks, Delegate Ebersol. That all sounds plausible for me, especially specifically about teachers, the amount of teacher training that happens annually, particularly the curriculum at the end, and then the difference between the private schools versus the public schools, right? It's a big deal. You know, what I am hearing though, that this is an issue, this is happening. We should think about ways to I wonder if any of the advocates know if the nurses, I think Delegate Rose brings up a good point about if nurses currently receive this kind of training already. We know that nurses are shared between schools and areas where there's a lot of students. But does anyone know if nurses are trained with to recognize seizures and how to help the student?
Mr. Chair, there is an advocate texting me trying to speak, and I'm not sure if she's on the wrong link or there's a problem.
Yeah, the link is sent out by by Alistair and
Sure.
Miss Ortiz has her hand up. Miss Ortiz, you want to comment?
Hey, good afternoon, Mr. Chairman, members of the subcommittee. Thank you, Jeanette Ortiz, Legislative and Policy Counsel with Anne Arundel County Public Schools. And so my folks have indicated that they believe that the health room staff would be the most appropriate because the nurses do receive the training. The one thing to note, however, is that not all school systems have nurses in their health room staff. However, my student support services folks did think that that would be the most appropriate place for the training, and also kind of alleviates the concerns related to another training for teachers who are not the best equipped, honestly, to address these issues. And because seizures can take on so many different forms and can manifest in different ways, like it's really difficult to capture that. And someone, whether it's a nurse or another healthcare professional, would be the best person to address that. So I think if that's something that you are looking to sort of target, who's trained, that we would be very supportive of that. Thank you.
Thank you. And Ms. Jeanette, Miss Ortiz, excuse me. Do you currently are the nurses? Do you know if the nurses are trained? Your nurses at your school system?
So I can't speak for all nurses in school systems, but Anne Arundel County Public School nurses, yes, do receive training.
They do receive this type of training.
Yes.
Got it. Okay.
I should note really briefly on the bill, as it came in, the requirement was that to fulfill one of these positions, it had to be a nurse who was located at the school, so not a nurse that's shared between different schools. There were two Senate amendments that came in. One made a number of modifications, including allowing that person to be just any nurse at a school. Additionally, it put not just the State Department of Education, but also the Maryland Department of Health in terms of coming up with health guidelines on this. And one amendment changed the content of the curricular standards that Delegate Ebersol mentioned, and the second Senate amendment would just remove those curricular standards. So those are the amendments, and they were shared by the sponsor with our subcommittee, though hard to keep track of these things sometimes.
Okay, Delegate Rose. Thanks.
Thank you, Mr. Chair. Just to, I think to go off of what Kevin was bringing up. So if we get that data and we find that overall this is not something that is in every single school, is there a way to amend the bill so that instead of having so many prescriptive parts of it, could we make it so that it's a conversation between families and the school? Is there a way to do that so that we can address those issues so that parents have an avenue to know that there's someone there to care for their child, but without making it uniformly across the state? That was just my thought.
Yeah, I appreciate that. I think the response to that was that it's for the first time in schools most times. And so the parents don't even know that it happened until it happens in school, right? So, but I appreciate that. Delegate Polakovich-Carr.
Thank you, Mr. Chair. Picking back up on the thread earlier about recognizing that not all nurses are in one school at a time, but is it true to say that every public school across the state does have someone staffing the health room every day, or is that there would also be instances in certain parts of the state where if we chose that person as one of the designated spots, where again there might be a school that doesn't have coverage on certain days?
Yes,
I'm not sure if anyone knows the answer to that.
Yeah, does anyone know the answer to that? Any of the advocates? Might raise your hand if you know the answer to that. And Alistair, I wonder if we even thought of like the school-based health centers too. And this bill, which is prevalent in Blueprint. Miss Storette. Hey.
Hi, yes, thank you. Dawana Storette with Baltimore City Schools. Thank you for allowing me to speak. In Baltimore City, not every school has a school-based nurse 5 days a week. We do share them with other schools. We don't have the ability. And it's also finding nurses is very difficult. And we rely on the Baltimore City Health Department to supply nurses to city schools. And they are having difficulty in finding nurses.
Thank you, Mr. Red. I'm gonna take one more question, Delegate Hornberger. We're not moving the bill. So if we can, if your question is imminent, we can take it now. But we're gonna go to Delegate Guyton first.
Okay.
Thank you, Mr. Chair. I just had the answer to some of our questions from the advocate who wasn't able to get on. 1 in 10 kids have seizures in Maryland schools. 1 in 26 are diagnosed with epilepsy. And apparently the Maryland Association of School Nurses gave written and oral testimony that feel like this is an emergency situation and that they would really like to have this because they don't have the necessary training. So that just answers some of the questions from my text. Thanks.
And they submitted that as testimony. Thanks. Delegate Hornberger, quick question.
Yeah, just real quick, having dealt with this in my other job, when someone has a seizure, there's no real symptoms that they're about to have a seizure. It's a completely random event. And when it occurs, really what needs to happen is you try to prevent the person from injuring themselves by running into something or flailing or hurting someone else. So, unless you have one of this trained personnel following that student around for the entire school day, that's the biggest part of it. That's not going to change. So in terms of, having all of these people that are qualified hovering around the students, it's just the practicality of it. It sounds like more there just needs to be someone that can be reached or at another school that can come over and kind of help them triage after it happens. Just a comment more than a question. Thank you.
Thank you. Okay. All right, guys, we're going to move on from this bill. And I got some feedback and some thoughts. So, Alistair and myself will take another look at this bill and get something over to you guys if we can. Let's move on to our next bill, House Bill 377. This is Delegate Bagnell's bill. This is for consideration for the subcommittee. I did send around an amendment to everyone. Alistair, you want to explain what this bill does?
Yes, absolutely. So this bill creates a commission on student behavioral health and mental health treatment. It provides for the membership of that commission, And it requires that that commission study behavioral health treatment and practices for students who are dealing with behavioral health and mental health issues, including the scope of practice, age of consent for services, types of service, and duration of treatment. Additionally, the commission must make recommendations on actions necessary to improve current practices and revise guidelines for student behavioral health and research ways to coordinate school-based health practices with healthcare provider practices in order to implement, in order to improve treatments. Then this commission would report back to the General Assembly in December of this year and December of next year, and then they would cease to exist in 2023. The amendments to the bill add a couple members to the commission. One representative of the Maryland chapter of the National Association of Social Workers would be added. One representative from a community partnered school behavioral health services program, and 2 representatives from different organizations that provide behavioral health, primarily to racial or ethnic minorities. Additionally, the duties of the commission would be expanded to investigate the unique behavioral health needs of students of different racial and ethnic backgrounds, including the differences in scope of practice when those students are provided with behavioral health treatment and types of service and duration of the treatment. And that is the extent of the amendments.
Okay, so this is a commission on student and behavioral health and mental health treatment. Obviously, we're through the blueprint, we're going to be investing a lot of money in mental health services, and just throughout, we're looking at mental health services. I think the bill is a quality bill. Alistair, a few things, the amendments that came to you, did you explain the amendments already? Did I miss?
Yeah, I breezed through them perhaps a little quickly.
Okay, don't worry about it. I think that just looking at some of the dates, it looks like we should push some of these dates out just a little bit, because they're asking for us to have it due, one of these reports to be due by December 1st of this year. And if we can just change that to maybe a year from the bill's implementation, can be a quick amendment that we change just to give them some time. We know the governor is going to appoint these folks within 60 days of the commission, but we should push that out just a little bit. And they can do another one on December 1, 2022 if they like. And I think they should also report to MSDE. So we not only just to us, but to also MSDE. Any questions on the bill? Any concerns? Do I hear a motion on the amendments?
Move favorable.
Okay, so I'm properly moved, and any seconds?
Second.
Cool. It's been properly moved and seconded. We're going to take up all the amendments as one. All those in favor, say aye.
Aye.
All those opposed? Seeing none, the bill passes. Perfect. Thanks, guys. All right, so let's move on to House Bill 401, our very own Delegate Guyton's bill. I'm going to ask Alistair to give us a brief overview, and Delegate Guyton, if you can chime in and give us your perspective on it too, that'd be great.
Thank you, Mr. Chair. So this bill requires that the State Department of Education develop a model policy to support the education and parenting goals of students who are pregnant or parenting. The model policy must include a couple things. One, it must require each school to designate a private lactation space that is located close to a sink and refrigerator, includes at least one seating option, and is not a bathroom or closet. Additionally, the model policy would require schools to assist and advise pregnant and parenting students in finding safe, affordable, and reliable childcare and transportation services to and from school. Each county board is required to develop a policy based on the model policy. And that is, I hope, the scope of that bill.
Okay, Delegate Guyton, any other comments
I think Alistair did a great job explaining the bill. It's fairly simple, just that we have a policy in place that young mothers have a place to pump or to nurse their babies and clean their pump, which is the use, of the sink, the necessity for the sink in the refrigerator, and that the schools are at least attempt to assist and advise them on transportation and childcare issues. They're not required to provide them, but they are required to help them if they can get that information for them. So it's fairly simple. And I just want to remind this committee, we do have 2 different bills also that have been introduced to collect data. One through the Maryland Innovation program, and then the other.
Delegate.
Yes.
Delegate, we'll get to those bills at another time.
Done.
Okay, you have a lot of questions here. I'm not sure if they're playing the game with you. No. But let's go to our first question. I thought it was Delegate Hornberger first, actually. Go ahead, Delegate.
Yeah, the same question I posed during the hearing, and if we've got any updates, but just the fiscal impact or fiscal mandate on the local Board of Eds.
There is none.
Okay. Yep.
Yeah.
Great. Thank you.
I think they reported in the fiscal note, Delegate, that that the cost of creating these lactation rooms might be high. So it might need to be tweaked a little bit, the language, just to be clear that you're not requiring a new creation of a space or something to that effect.
In the bill, in the fiscal note, it does say St. Mary's County reported back saying that it will cost $17,500 one-time cost, so there is some numbers in here.
I apologize. I think last year's bill had a fiscal note based on the concept that they would need to build spaces, but we got rid of that in this bill. So that's why I would say, I'm sorry. I think Diana Phillips is here too. I don't know when you want to hear from her. She's been involved in that conversation.
Yeah, let's do this, Delegate. I'll direct questions your way if there's questions. So let's have a discussion. But let's go next to this is all out of order. I want to say Delegate Hartman. No, Delegate Hartman. Delegate Polakovich-Gar.
Thank you, Mr. Chair. I really like this legislation and appreciate that Delegate Guyton brought it forward. Actually, one question for you, though, Delegate Guyton. So, with the lactation spaces, this is, an issue for women of all ages, and clearly pregnant and parenting mothers are dealing with a lot of other things. But actually, those lactation spaces would be a benefit to the staff at the schools as well. That just occurred to me. Isn't that right to say that it's would be supportive for teachers too? All right, thank you.
Sure, absolutely.
Thanks.
Delegate Hartman.
Thank you, Mr. Chair. My question was just a follow-up, to Delegate Hornberger and the maker of the bill, Delegate Guyton. When you're saying there is no cost, because I did go back and look at the fiscal note, and it was very definitive that local boards could have significant costs. So if we can get clarification on that later, that would be much appreciated.
Certainly. Mr. Chair, can I direct that to Diana Phillips now? Because I think she has more information about that.
Sure,
Okay.
Miss Phillips, you have any answers to the school system's fiscal?
The intent has always been existing spaces, that there was not an intent to hire additional staff. There wasn't an intent to build anything out. And so it's using community resources in existing spaces. And also I want to echo about what the Delegate Polakovich-Gar said, is that staff members and faculty have been looking for those lactation spaces too.
Absolutely. Okay. Thank you for that. Okay. 2 more questions. Delegate Ebersol.
Thank you. So it's good because we got an answer, but it leaves a question. We talk about it being existing spaces. What sort of existing spaces are there within schools right now that already have a refrigerator and plumbing and a sink in them therefore, that we're thinking that we might use instead of creating new rooms? Does anybody know the answer to that? I feel like it might end up being where faculty sometimes congregates, which is going to be a little uncomfortable for the student and for the faculty, I believe.
Correct.
Just not that they'd be, obviously expressing in front of them, but they'd be passing through the room.
Yeah,
so
we're thinking of. Yeah, just to throw something out there. Going to one of my schools, one of my high schools, they didn't have that space there for students. And even in the where the teachers, the teachers' spaces, they had a refrigerator, but no sink nearby, right? The sink was within the bathrooms, right? So it just all seems kind of weird because we have these old buildings that we all have, right? But I think it's something that we should talk about, though. Does anybody let me ask anyone from the audience that can speak to that particular question?
Yeah. Well, I think the intent of the bill, Mr. Chair, is that there's a private space to actually do your pumping or your lactation. You don't have to have a refrigerator within reach of that space, right? You just have to have access to one. You don't have to have a sink, within reach of that space. You can get up and wash yourself. So I think there are certainly ways around that so that you can use existing facilities for that. But the space itself, for obvious reasons, does need to have some privacy.
So if I can follow up, or we take too much time on it, I can.
Go ahead. No, go ahead. We have time.
Okay. So then we're talking about an existing space, but I think the language need to be softened significantly, because the way it reads to me when I first read it is you got to have a room with those two things in it for sure. And I'm just not sure. And we're going to make every school, I understand. Thanks for getting around to that, Delegate Plavkovich Carr. I was going to ask about elementary schools too. But actually, it's an excellent idea, since there are staff members and possibly elementary school students. Not nearly as probable, but still possible. But I think we need to look at that language.
No, I think that was a great point by Delegate Plavkovich Carr.
No, she makes them. She's pretty good at that.
Right. Okay. Delegate Ebersol, you got anything else?
No, thank you very much. That's good.
Cool. All right. Delegate Jones.
Thank you, Chairman. Delegate Guyton, thank you so much for this piece of legislation. I am very appreciative of this bill. I was reading it this weekend, and I had a question. I'm not sure, this brings apart something that I think we do need to talk about is the fact that, and I'm so happy that it was brought up, that there are mothers who are also teachers in the building who could use this space. And here we are, 2021. Let's take a look at how we treat mothers in the workplace, as well as those who are trying to achieve their high school degree. So my question, how did we first learn about the challenges that parenting students have been facing? I know that when I was in high school, it was incredibly hard for women, young mothers who were having their children to get that high school degree. But how did we come across the challenges that parents and parenting students have been facing here in our state of Maryland?
Sure. Thank you so much for that question, and both you and Delegate Plavkovich Carr for bringing up the other obvious use of this area. I think that is really important. You were not here last year. We're glad you're here this year, Delegate Jones, but we did have a big hearing last year where I was not the sponsor carrying this bill last year, but with many mothers, with many teenage mothers and high schoolers that came and expressed their concerns. And we also just look at the numbers, how many of them actually do drop out and the reasons they give for doing so. And we feel like this bill could really address some of those issues. But this bill was brought to me by the sponsor last year, Alice King, who, so that's how it got to me. But thanks so much. I don't know if Ms. Phillips wants to say more about that, or if that answer is sufficient.
No, I think, yeah, I think, Delegate Jones, go ahead, Delegate Jones.
Chairman, I just wanted to add that, this bill affects so many young women. 60% are forced to drop out. And I would really love to see us support young women who are trying to achieve their high school degrees, because we know that their children are more at risk of repeating grades, of not achieving their high school diplomas, and so many other things. So I'm very appreciative of this legislation.
Thank you. Can I just ask a question for maybe MSDE, if they're on, which I'm sure they are not, or Mr. Willems? Maybe you can answer this question about teachers having access to their own spaces. That's not the teacher's room. What's that place called? Teacher's lounge. There we go. Yeah, we're never allowed in there, Delegate Ebersol.
Yes, it's a very secret place. You see it on TV all the time, though, don't you?
Correct. John Willems, can you tell us, Mr. Willems, can you tell us if there's space offered to lactation spaces or breastfeeding spaces for teachers in the school buildings?
Yeah, thank you, Mr. Vice Chairman, members of the subcommittee. In my written testimony, I certainly tried to highlight that the Affordable Care Act includes a provision that all employers have to provide this space, so that this space should already be provided for our teachers and other school employees. That requirement is not quite as prescriptive as in this bill. For instance, it says not a bathroom, but it doesn't say not a closet. And I don't want to be too cute about how grandiose our closets can be, but Delegate Ebersol probably knows that some teachers feel like they're working in closets. And so that is one of the things that I point out in my testimony. We're already required to provide these spaces for our employees. And so these spaces should already be available for students with slightly less prescriptive requirements than are in the bill.
Correct, but I mean, I guess the question would be, is it offered, right? I mean, it's offered right now to all teachers and all parents in the classroom or in each school right now? Is that space being offered? Is there a designated space within our schools right now? Or it's
I cannot say other than the federal law requires that it be provided for the employees. So I cannot say with regard to the separate space being provided for the students, particularly other than a bathroom. I mean, that's the important, one of the key provisions for employees that I think also makes a lot of sense for the students. There are no sink and refrigerator requirements under the federal law. While they clearly make sense, that is where some of our cost issues arise, and appreciate the sponsors' interest in not mandating a separate physical space, constructed space.
Is there, I mean, I guess my question would be, has any of the boards promulgated any regulations on certain areas being required within the schools? Anything, any next steps after? I mean, is there anything else you can point to within our school system outside of just the Healthcare Act?
I cannot specifically, although, and this is where I don't have access to all the testimony that was submitted. I think you may have received testimony from at least, I want to say the Montgomery County school system, and they'll let me know if I'm right or not, that they have already adopted a policy. I know that several school systems have adopted policies. I just don't know about the lactation space accommodation within the pregnant and parenting student policy.
Got it. Okay, Ms. Ortiz, well, you just went away.
I thank you again. I just wanted to comment on that question. So Anne Arundel County Public Schools has a policy and regulation on the for employees on the requirements that established under the Affordable Care Act, and we actually received an award maybe in 2019 pre-COVID on our policy and regulation. And so to Mr. Woolham's point, we do provide spaces currently to our employees that could be utilized for students, but the concern again is the prescriptive nature of the bill before you with regards to the sinks and refrigeration and that sort of thing, just because of the nature of the way some of our schools are set up and if they're older school buildings.
Got it, fair enough. Okay, but you don't disagree with the language on a bathroom, not being a bathroom or a closet?
No, not at all. And that's in our policy and regulation. It's very specific. And so we actually work, it's on a case-by-case situation with a student that has a need. And so they work with their, counselor or principal to ensure that that student is accommodated.
Okay. Thank you. Delegate Jones, let me just go to Ms. Storette. Maybe they're on the same question too. So Ms. Storette.
Yes, hi. I just wanted to echo what Ms. Ortiz said. In Baltimore City, we have a parent and pregnant policy, parental student policy already on the board that follows the Affordable Care Act. And we do make provisions if there is a student that needs to have time to take care of this issue, that we provide them with an appropriate space. Now, the question we have is close to a sink or refrigerator, what is considered close? Because sometimes things can be in another area of the building and they take it to the area where we designate for them to do their lactation. So that's the concern that we have, but we are supportive of this legislation and we think we've have policies in place that comply with most of this legislation already.
Got it. Thank you very much. Delegate Jones, you still have a question?
Yes.
Go ahead.
Thank you. For Ms. Ortiz, I wanted to double check. While the county does provide this for teachers, I wanted to just ask, are students allowed to use that same lactation area currently?
Yes, and so the students are able to, they will have an area. So not all of our schools some have designated areas. And in some instances, for example, a teacher may want to use the teacher's classroom, right? That's the space that the teacher provides. And so the students are accommodated. So whether it's a particular room, a particular area, or if there are multiple opportunities for the student. So to succinctly answer your question, yes, we do provide accommodations for students. It's just not always one designated area. There may be multiple options.
And
like at central office, I can say we have an actual room here at the board offices that are for our employees or guests or anyone that needs it.
Right.
In a school, it may be multiple options.
I was more interested in from the student perspective, from the young woman.
Yes, and that's what I'll clarify. Yes, and so for the student, they would have an option to use a particular space and area designated for lactation purposes.
Thank you. Okay, I thought this was a great discussion, everybody. Definitely put us to a point where we can make a few changes.
Mr. Chair, if I could just do one more thing. I was just looking over the bill and I saw something, unless you're done. I can talk to you.
I'm done, Delegate Ebersol.
Got it.
No, go ahead. Go ahead.
No, if you just said you're done, you're done. I also do see that the bill says that the schools have to provide advice on childcare. I'm interested who they think in the building would be the person that would be able to give unbiased and good advice on how, there's lots of organizations out there. So maybe we could change that so that we'd say they would point them to organizations that could help them, like Maryland Family Network and places like that, rather than having someone in the building giving them advice like, well, my granddaughter goes to, that's in such a place. I think probably a little less biased advice, or perhaps broader.
Is that what the intent is? Or
I'm sorry, Delegate Jones, hold on one second. So Delegate Guyton, you want to answer this man's question?
I'm always happy to answer this gentleman's question.
There we go.
The intent of that provision is that they actually provide assistance and advice, and there can be many ways that can be fulfilled. And I see your point, Delegate Ebersol, and I think that that could be fulfilled by having the central office have pamphlets in the office, have lists in the office. There are lots of ways other than, certainly we don't want just a counselor saying, my granddaughter goes to so-and-so. Like, we want to have more information for them than that. But I think that's part of the original provision of the bill, which is that the county boards will actually develop that policy. So they'll be the ones to decide how that will happen.
Okay, great discussion, everybody. I appreciate it. And we are done with this bill officially. So no more questions on Delegate Guyton. I think you have a lot of feedback from today, and that we can start to work towards amendment for this bill. Cool. All right. Thank you. Next bill we have is HB 72, and we do have a few minutes on this bill. We passed this bill out as is last year, everybody. It was non-controversial, but Alice, want to explain what this bill does and then talk about the potential amendments that we're going to add to the bill?
Yes, absolutely. So this bill allows counties to provide, under current law, only what's designated as vehicle 1s or vehicle 2s can be used to transport students, except under very limited circumstances. So I'm sorry, type 1 or type 2 school vehicles, not vehicle 1 or vehicle 2. So what this bill would do is authorize a county board to provide transportation to and from school using a vehicle other than a type 1 or type 2 school vehicle, which are school buses, for certain groups of students. And those groups are preschool students, students with disabilities, homeless youth, children in foster care, students without access to school buses, students in non-public school placement, or students in dual enrollment programs, work programs, or other educational programs off campus. The State Department of Education, in consultation with county boards and the Motor Vehicle Administration, is required to adopt regulations on minimal vehicle and driver safety standards for those transportation vehicles. And that is the bill as it came in. We also have with us in our possession in the committee the Senate version of this bill, and the Senate bill added an amendment that would make this bill last for 3 years and would require that the county boards report on the types of vehicles that are used under the authorization of this bill, the number of county transportation employees with benefits, and whether those types of employees decreased as a result of this bill, and types of students that were transferred. We have an amendment that mostly adopts the Senate amendment, but rather than have it only last for 3 years, it would have the bill last for 5 years with a reporting requirement in 2025 and with an abrogation in 2026.
Yeah, we just felt that 3 years is way too short of a time period to gather enough data for us to analyze the program. So I thought 5 years would be just enough for us to come back and take another look at it and see what we can do to make any potential changes or any updates on it. So I thought it would be a good, since we're accepting the Senate amendments, we can change it up a bit. Delegate Ebersol for a question. And I'm sorry, Alice, let me ask a question first before Delegate Ebersol. It was an advocate that asked about this bill a little earlier. They were requesting if this bill does include Uber rides.
It could. It's not clear, and it would be potentially up to the regulations that the State Department of Ed and the Motor Vehicle Administration adopt, I think.
Correct. Okay, perfect. Thank you. Delegate Ebersol.
So yeah, we did pass this bill last year, but what's come to light is the bill we had earlier about vetting bus drivers. And so we're going to have a situation where we're going to have people. I'm curious if we want to put anything in the bill to require the same sort of vetting for them to be around children, especially if they're coming from different organizations. And at the same time, sorry, I didn't get to look at the bill real carefully yet, but I wonder if there's anything in there about also the vehicles meeting certain safety standards that our other school vehicles meet. So both kinds of safety, the actual mechanical safety of the bus, but also the safety of the person in contact with students. And I'm not sure we have anything in there about that. So
no, we don't have anything in there about either of them. Alistair, you want to talk about that?
Yeah, so I mean, the State Department of Ed and Motor Vehicle Administration are required to adopt regulations about school safety, vehicle safety, and driver safety. So that would potentially cover that issue, depending on what their regulations would be. Again, I think the thought last year in this committee was that we're not the best people suited to dictate what driver vehicle standards are the best, but that the regulatory process would be a good place for that. Additionally, that bill that we passed, Delegate Wilson's bill, I think would cover this because it covers people that the school boards contract with. And I believe the school boards would be contracting with some entity to provide these services. If you'd like, we could tighten that up to make sure that it states specifically that these people are covered under that provision. But
yeah, if we could reference that article, that would be great. Yeah.
Yeah, I think we can tie to that somehow. I'm not sure if the referencing would help, but Alistair, thanks for that question. Thanks for the answer to the question. Should we hold this then for the purpose of that amendment, Alistair? Or can you get that?
I think we can pass it. It's a fairly
easy amendment.
Yeah, I think it's a fairly easy amendment. So if that's okay with you guys.
Sure. Yeah, absolutely. I see Delegate Hartman is itching to moving this bill.
He's more concerned about people paying fines at libraries and kids riding buses, dangerous buses. So.
Okay, Delegate Hartman, any questions or any motions on this bill on amendments?
Move favorable.
Second.
It's been properly moved and seconded on the amendments. Any discussion? All those in favor say aye.
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 All those opposed, on the bill as amended. Delegate Hartman.
Move favorable, thank you.
I'd like to
Yep.
second it for Delegate Hartman, if I could, please.
It's been properly moved and seconded. All those in favor say aye.
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 All those opposed. Okay, all right, everyone. That concludes our hearing for today, our meeting for today. Thank you, everybody.